If you suffer from that painful and debilitating condition known as bunions, then this video is for you. Hi, I'm Dr. John Ehring, a chiropractor here at Body in Motion in Denver. And today I'm going to talk about how we assess, treat, and train bunions for pain relief, to halt the progression, and in many cases to even reverse the progression of bunions. All right, so your bunions are actually a constellation of three different symptoms. We get a callus building up on the outside. Behind that, the bursa, or a little fluid-filled sac, becomes inflamed. And then ultimately, we get a bony outgrowth. All this contributes to a lack of function or a loss of function in the foot. And when we start walking around that pain, our problem is allowed to only progress. So assessing it here in office, we first take stock of the angle of the toe pointing in, and it's that angle that indicates how severe the issue is. Then we look at joint motion, both of the big toe and the ankle, which indicate if the foot can be a foot. And we also look at muscle extensibility here in the calf, which when too tight pulls the heel up off the ground too soon in our gait cycle. So we assess those things, and we also look at muscle strength for the prime stabilizers of that joint. We've got abductor hallucis here on the inside and fibularis longus on the outside, wrapping down around our foot and inserting right below our bunion. So in office, we're going to mobilize and lengthen that tissue, mobilize those joints, and teach people how to access those stabilizing muscles and feel them so that they're able to work on strengthening them over time. We have some tools that we utilize. This is a Toe Pro. It's an excellent platform for strengthening the toes, the abductor hallucis, and the fibularis longus. We use a lacrosse ball to mobilize a lot of that tissue. And then we talk about utilizing toe spreaders to put our toes at a more normal position and provide pain relief. Additionally, footwear is very important. Oftentimes people are squeezed into too tight of shoes, making their problem worse. And orthotics can play a role, but they can be a solution for some, but they're ultimately not a long-term solution. So if all this idea of conservative care really makes sense to you and you want to pursue restoring function and strengthening the things that are there to do this job to prevent bunions or manage or even reverse, certainly don't hesitate to reach out. We are always available for a discovery call or for you to come in for an appointment.